It is roughly about 3:40 p.m. We're going to open up with public comment first. Pursuant to Section 8-44-112 of the Tennessee Code Annotated, time is reserved for public comment on legislative items appearing on this agenda. Members of the public may wish to speak, may sign up on the council committee sign-up sheet posted outside the room where the committee is scheduled to meet. Public comment, sign up for council committee meetings will end immediately after, or before, I should say, the meeting begins. Public comment is limited to 8 minutes total at the council committee meetings, and each speaker is allowed up to 2 minutes to speak. All public comment speakers must present proof of Tennessee residency. Just one more quick thing, requests for interpretation services and/or accessibility accommodations should be directed to the council office. And we've got one member signed up today, and that is Mr. Howard Alley. If you want to go ahead and make your way to the mic, I'll turn it on for you, sir. Oh, this is the public comment period. Yep. So if you want a chance to speak, this is the time in the meeting to do that, sir. Oh, okay. Okay, members have their agendas in front of them. Currently, everything is going to be on the consent agenda. I'm going to read through them really quickly. Just let me know if you have anything that you would like to take off, and then I'll come back through and read the captions once we vote on that. First item, RS 2025-1082, a resolution accepting a grant from A Step Ahead Foundation of Middle Tennessee, Inc., to the Metropolitan government acting by and through the Metropolitan Board of Health to provide reimbursement for certain costs associated with providing long-acting reversible contraception. Sponsors on this, Porterfield, Evans, Welsh, Allen, Gadd, Huffman, and Toombs. Number two, RS 2025-1083, sponsors Porterfield, Evans, Welsh, Gadd, Huffman, Toombs, and Ellis, a resolution accepting a grant from the Tennessee Department of Health to the Metropolitan government, acting by and through the Metropolitan Board of Health to provide oral disease prevention services for school children grades K through 8 in qualifying public schools. Item number three, RS 2025-1084, sponsors Porterfield, Evans, Welsh, Bradford, Gadd, Huffman, and Toombs, a resolution accepting a grant from the U.S. Department of Health and Human Services to the Metropolitan government, acting by and through the Metropolitan Board of Health to provide for the prevention, surveillance, diagnosis, and treatment of HIV/AIDS to administer a minority AIDS initiative program. Item number four, RS 2025-1085, sponsors Porterfield, Evans, Bradford, Gadd, Toombs, Ellis, and Hancock, a resolution accepting a grant from the Marjorie A. Newhoff Private Foundation, Inc. to the Metropolitan government, acting by and through the Metropolitan Board of Health to provide funding for the care of shelter animals at the Metro Animal Care and Control Center. Item number five, RS 2025-1086, sponsors Porterfield, Evans, Welsh, and Toombs, a resolution approving Amendment 1 to the grant from the Tennessee Department of Health to the Metropolitan government, acting by and through the Metropolitan Board of Health for public safety partnerships in high-impact areas to use available data to identify populations at high risk for adverse consequences from substance abuse and employ evidence-based interventions that are responsive to population needs. Item number six, RS 2025-1089, sponsors Porterfield, Evans, and Toombs, a resolution approving a sole source contract between the Metropolitan Government of Nashville and Davidson County and Zoll Medical Corporation to provide cardiac monitors, AEDs, accessories, and preventative maintenance and repairs, Zoll-specific software, including Zoll Cloud Services. Item number seven, RS 2025-1091, sponsors Porterfield, Evans, Huffman, Toombs, and Ellis, a resolution accepting a Homeland Security grant from the Tennessee Emergency Management Agency to the Metropolitan government, acting by and through the Office of Emergency Management to implement state and homeland security strategies by addressing and the identified planning, equipment, training, and exercise needs required to prevent, respond to, and recover from acts of terrorism. These are the items on the proposed consent agenda. Does anyone need anything removed? All of them. Do I have a motion for the proposed consent agenda? Second, all those in favor, aye. Any opposed? Okay. That was easy enough. Also, want to introduce some folks that have made a long trek to Nashville from the city of Austin, Texas. Back in November, I was at the National League of Cities, which all members are encouraged to attend. Some of you were there. I met a contact in Austin at that time, and the conversation started off with, hey, you guys handle homelessness really well there. And that has led to a budding relationship, which has already turned into one trip with Director April Calvin making a trip to Austin. We're so fortunate to have this delegation here. So with us today, Nicole Jocelyn with the City of Austin Community Engagement Team, Andrew Willard from the City of Austin Senior Planner, Dr. Aaron Alarcon, he is from Family Elder Care, and lastly, the contact that I made, Mr. Matt Curtis, he is not here with us today, but we know he's here in spirit. He decided to go to Dublin, Ireland instead. Probably a little bit more fun. If the folks from Austin want to make their way up here, we've got just a short presentation that they just want to run us through.
Okay, great.
Okay, and we advance the slides. Great.
Well, first, we want to just thank y'all for having us. We all, I think as we're introduced, we can do some quick intros, but we were kind of invited by your kind of homeless strategy office as a sister city to come talk about how Austin has kind of invested in its homelessness response system, specifically around our permanent supportive housing investments. And so we have a short presentation, and then we're happy to field any questions you all might have. As was said, my name is Andrew Willard. I'm a senior planner with our Austin's Homeless Strategy Office. Yeah, Nicole.
My name is Nicole Jocelyn. I'm with the Housing Department of the City of Austin. I manage our real estate and partnerships in affordable housing for Austin.
I don't think it works. Yeah. Thank you. Good afternoon, Dr. Aaron Alarcon, CEO of Family Elder Care, a nonprofit organization that serves Central Texas by providing services to older adults and adults with disabilities.
Thank you. Good afternoon. My name is Jason Phillips. I'm the Director of Systems Advancement at the Ending Community Homelessness Coalition. We're a nonprofit organization in Austin, Texas that serves as the continuum of care lead in Austin and Travis County. Good to see y'all.
So we can move on to the first slide here. Unlike Metro in Austin, our COC lead is ECHO, and then the city is one of the major funders of our homelessness response system. Over the last kind of 3 to 5 years, the city of Austin kind of came to the realization that we need to substantially increase our investments in permanent housing supports in order to address homelessness in Austin. We have a rather large unsheltered homelessness population at around 3,900 unsheltered with 1,000.3 sheltered individuals. And so to that end, we kind of have begun to invest in site-based permanent supportive housing. Site-based PSH kind of requires 3 funding sources to work. First, you need the capital to actually build the building. You need wraparound services, and that's what my office, as funded by the city council, will invest in general funds in. And then lastly, we need the rental of substances. We either use local housing vouchers the city of Austin has created, or we will fund it from the Housing Authority of the City of Austin. So these 3 pieces, capital investment, wraparound services, and rental assistance, are necessary in order to build PSH buildings similar to the ones that we toured in Metro, Scobey House, I think it's called. And so we really saw that while we'd been investing from our COC side in scattered site PSH, and it works for a number of individuals, we really need to invest in site-based PSH to kind of address the large cost of housing in Austin, as well as just the lack of access that we saw from our provider community, as well as those experiencing homelessness. So you'll see on the slide here, the City of Austin's investment in permanent housing projects. So this is just rapid rehousing and PSH. The City of Austin invests in 2024-2025 fiscal year, we invested about $13.5 million in ongoing rapid rehousing and PSH services. The COC invests $13 million in rapid rehousing and PSH services. So this is not counting the city's investments in emergency shelter, street outreach, public space management, those kinds of strategies. This is just our investment in permanent housing. The state invests about 2% into our local homelessness response system, and the city gets about 2% of our total investment in ESG from the federal government. So this is just kind of a snapshot of what we as a city have determined is necessary for us to contribute with our general funds to address homelessness in Austin.
And here's a graph of what our permanent supportive housing development pipeline looks like over the next few years. As Andrew said, we've been working hard to increase the number of permanent supportive housing units over the last few years. So the units that you see coming online this year and next year are projects that we started working on in 2020, 2021. That's just the timeline it takes to get units on the ground. We currently have 480 units in operation. We anticipate another 338 units coming into service this year, and then 527 additional units up through 2026. So it's a total of 1,345 permanent supportive housing units that the City of Austin has invested in. That represents $122.5 million of gap financing provided by the City of Austin. These projects there's a variety of projects in that portfolio, including hotel conversions that the city owns and invested in the conversion of, and then a number of new construction projects that are largely tax credit projects, and then projects that were co-funded between the city and Travis County. So as I said, $122 million in gap financing from the City of Austin. The sources for this include voter-approved general obligation bonds. We passed a large bond in 2022 of $350 million for affordable housing development and $250 million in 2018. And we'll be looking to put another bond initiative on the ballot in 2026. We also were fortunate to have Travis County for the first time invest in the development of permanent supportive housing in our area. They provided $115 million of their ARPA local recovery funds for the development of permanent supportive housing. We also are able to provide access to public land for the development of PSH and other affordable housing developments. And through a partnership with our Housing Finance Corporation, we're able to provide a 100% property tax exemption for those properties. So that helps with that ongoing operating cost for those properties. We also have tools available to reduce the cost of development and to reduce the time that it takes to get permits for affordable housing and permanent supportive housing. We have a program called Smart Housing that waives our permit fees. And we also have an expedited permit review team embedded in our development services department that specifically works on public projects, including permanent supportive housing. So those projects can get their permits much faster than other developments in the city. We also have density bonus program that provides a by right entitlement for affordable housing so that that project doesn't have to go through a rezoning if they're providing deeply affordable housing. We also have our local housing voucher program that Andrew mentioned. We provide $4 million a year into our local housing vouchers that are the local funds. So that comes out of our housing trust fund. That housing trust fund, the piece of the housing trust fund that's invested in this comes from property tax revenue from properties that were formerly publicly owned. So when federal, state, or local land goes back onto the tax rolls, we take that tax revenue and council allocates a portion of that every year to our housing trust fund. Those are the dollars we use for our local housing vouchers. We have 374 vouchers committed right now, and that's full commitment. That's all of our funds. Those are across 7 projects, 3 of which are in operation today. And I also want to mention another funding source for that gap financing that I forgot about. We have a downtown density bonus program that's been very helpful in investing in permanent supportive housing. Our downtown area developers can access additional entitlements for the development, additional height, additional density, by paying a fee in lieu into our housing trust fund. And that's our density bonus program funds, and those can only be used for the development of permanent supportive housing. So those funds kind of come in year by year. They're different depending on the development activity in downtown, but last year we received $4 million into the downtown density bonus program.
In 2021, the city of Austin acquired 5 hotels, and the purpose was to repurpose them for different reasons. One of them is Pecan Garden, which is located in the north part of the city of Austin. And Family Elder Care, the organization that I represent, is very honored to partner with the city of Austin to manage this facility, which serves older adults and adults with disability over the age of 55 that are exiting homelessness. Pecan Gardens has 78 units. And in the slide, we can see the cost of the project. Purchasing the hotel was approximately $9.5 million, and rehabbing the hotel into a PSH facility was approximately $5 million. Family Elder Care has 2 contracts with the city of Austin, one of the Homeless Strategy Office, which provides the services to our residents, and another contract with the Housing Department. And through this contract, we manage the asset and also supervise the property manager, which is a company called VOA, Volunteers of America. These are the services that Family Elder Care offers at Pecan Gardens. The first one is case management associated to PHS. And the case management is very intensive. We develop an individualized service plan to all of our residents, ensuring that they are meeting their goals. We also have another service, which is called service coordination, and this is a less structured, more casual approach to case management. And the service coordination service complements the very intense case management offered by our PSH case workers. By the way, we have a ratio of 13 residents per 1 PSH case worker. Another services that we offer is peer support, which helps our residents cope with mental health and substance abuse issues. Then we also offer SOAR specialists, which assist our residents obtain income by applying to disability and hopefully be successful in their application. We also have partnerships with community resources. We have a partnership with the UT School of Nursing, which provides very basic and preventive health care at Pecan Gardens. And we also have another MOU with the healthcare provider, the mental health provider in Williamson County. Family Elder Care, besides providing PSH, we have a role of managing the assets, making sure that the asset is protected. We also, as I said earlier, supervise the property manager, ensuring that the property manager meets the needs of our residents. And we also have a financial fiduciary responsibility to ensure that the asset is managed properly.
So all of those services are necessary for PSH to work. It really needs to be wraparound services. The city of Austin has determined that in order to fund PSH, it's about $20,000 per unit, which is a high price tag when you're looking at per unit costs. Why this is necessary and is a challenge, right, is that PSH is the most robust intervention that we have as homelessness response systems. It accounts for the high cost per unit, but as well is correlated with high outcomes that we've seen in the both on the ground in Austin as well as kind of in the literature nationwide. PSH is built to serve the population that usually has the highest barriers and is most difficult to stabilize. And the other challenge with PSH system-wide is it has the lowest kind of turnover rate because that population needs typically more lengthy services. You can still serve the population with, say, other interventions like rapid rehousing or with shelter. You're not going to get the same positive outcomes. We've done some research locally for typical PSH clients served in rapid rehousing. We tend to have like a 1 in 3 success rate, as opposed to in PSH, you're looking at like a 9 out of 10 success rate. Same thing with kind of shelter, right? Someone might be able to exit homelessness that might need PSH services. Their term in shelter might look more like 5 or 6 years, where in PSH it might be somewhere around 2 and 2.5 on average. Some of the benefits of PSH development, first off, is it greatly reduces the likelihood of this population dying on the streets. It supports positive exits for those with the longest histories of homelessness. Again, that goes back to this population stabilizing more consistently with PSH as opposed to other interventions. On the development side, you're getting kind of guaranteed rental payments, support from the on-site case managers, as well as from a property management standpoint, you don't have to go look for your tenants. The COC and the community just kind of, hey, we found them, go for it. And then lastly, you can kind of reduce some of those operating costs as a city government by using kind of the housing department's various strategies and levers. So that is kind of all of our formal presentation. We've also been speaking with a number of your staff and community members over the last 2 days. We've had a lot of great conversations, which we've all really enjoyed and have been illuminating also for what we can bring back to Austin. But we're happy to take any questions y'all might have. And so I see a few hands. Yes, ma'am. Or I don't know how this happens.
Thank you. No, you're good. Councilmember Prepteek, go ahead.
Thank you, Mr. Vice Chair. I'm curious for y'all if you've had to navigate or how you navigate the issue of preemption and whether or not Texas has preempted the city of Austin, specifically in the area of housing, and how you all are trying to navigate that with increasing your housing stock to serve these vulnerable populations.
What was that? Preempting? Here we speak to. Oh. I think thankfully our current mayor has a pretty good relationship with the state legislature. He has been able in a few instances to actually get some additional dollars from the state to assist our kind of homelessness response system. I think also we've tried to be as creative as possible to utilize the levers that our housing department has available to it to provide these incentives and address kind of both affordable housing crisis in our community, as well as for our specific population, PSH. And so I think it's a two kind of tier approach, right? High housing costs overall are going to impact your homelessness inflow, while also, this population, high acuity individuals do need those specialized services. So it's not just a affordability issue.
Any other follow-ups? You're good? Okay. Councilmember Weiner.
Thank you, first of all, for being here. We're delighted to be able to have this conversation. My single question is, what tools do you have available at your disposal to move this population, especially those in this population who deny support services? They don't want to go. How do you get them there?
You probably can speak to this as well. I think, our community has pretty strongly embraced the kind of research around housing first. And so we found that, when we are able to offer someone a PSH unit, there are very few individuals that decide not to pursue that opportunity. I think, and Aaron can speak to this too, around individuals coming into Pecan Gardens, knowing that it's such a service-rich environment. I think the other pieces on your street outreach teams, making sure they're able to proactively engage individuals. I'd also say, even in the PSH units, this is something that Austin has kind of learned over time. is it's not enough just to like have a case manager there, but making sure that your support services are like proactively reaching out to your individuals, forming those connections. You know, hey, you might not want to work on, I don't know, your employment right now, but maybe you do really want to get your SNAP benefits. So this can be an inroads with that case manager on developing that relationship. Once the individual kind of trusts the case management process, trusts the community a little bit more, you know, they might have had some negative experiences in the past. You know, in my own work, I've seen that be pretty transformative in the ability to elicit change, both in the individual as well as kind of stabilize their situation.
So I guess my only follow-up question to that, because I would love to hear from all of you about this, what are your criteria for accepting someone? So if someone doesn't want to give up, for example, here, their drugs or alcohol, they can't come in. So what system do you have in place that would be comparative to that?
I can talk about it. You can talk about it. You want to talk about harm reduction and?
You know, I just want to piggyback on your first question, if I may. I think I have never seen a somebody exiting homelessness that refuses a placement. That doesn't mean, though, that they might be saying yes. However, if this person has been in the street for 15, 20 years, once they're housed, they face a lot of challenges, right? Their mind might say yes, but the habits that they've been dealing with for so many years are in their way. That's why we believe that it takes a village. That's why Family Elder Care provides all these services to ensure that we help our residents overcome all the past trauma that they had from being in the street.
I'd also say, you know, in permanent supportive housing, individuals do have to follow the tenets of a lease, right? They have a lease, they have to follow their lease requirements. And so I think this is where like the supportive services come in at making sure your projects are funded for the ability to provide people, you know, inpatient services, harm reduction services, receive that training, make sure the individuals understand like, hey, you are going to face some behaviors that need to change. I think it's also so critical for you to find good development and property management partners who can, you know, understand the population they're working with, right? Maybe a more traditional landlord that's going to say like, hey, first offense, we're evicting you, isn't going to be really successful in working with this population because those kind of lease notices or warnings can be a tool in the like stability process, especially when paired with great case managers and good service providers who can come behind that lease notice and say like, hey, you got a notice for maybe using in your unit or something, right? This is the time where you don't want to lose your housing. You work so hard to get here. Now is the time to get into maybe a recovery program, or now is the time to do some like inpatient recovery services. So I think, you know, to your question, like what's the criteria? We're not going to exclude individuals for kind of past criminal history behavior. We're trying to be as kind of low barrier and meet the needs of the population. It doesn't make sense for us to fund PSH that can't serve those high acuity individuals. Like that's just not going to help. We're not going to have the intended impact there. While at the same time, like helping move towards stability.
So my last one, every time you give me an answer, I come up with another question, so I'm sorry for that.
That's great.
Can you speak a little bit about the outcomes that you have experienced since the inception of the program? You know, maybe percentage of people that have had to leave the program, percentage of people that have completely turned it around. I think that information would be really informative. Thank you.
Yeah, thanks for that question. We have a couple of reports that we publish every year as a homelessness response system that has those outcomes, and we're happy to share all that with y'all. AustinEcho.org, some of them live there. What we see with our PSH is typically we're seeing a 95% or higher permanent housing retention rate. And so those are folks that are either staying in permanent supportive housing. Most are staying in permanent supportive housing for a very long period of time because they need those robust services. But it also could be folks that what we would call move on from PSH in our community, and that's where maybe they're now in a stabilized position, but they're still needing a rental subsidy. So where we're able to kind of transition them over to a more traditional apartment or community living, and then that opens up a spot for someone else. So we are seeing that it does come with its challenges. We do have to, rehouse folks, so it's not a one and done, because what we notice is that when we're not continuing to provide those long-term services, folks are ending back up on the streets with additional barriers, are more sick, and harder to house again. And so we really have those minimum standards within our community to continue that care with folks.
I'd also say that, one thing that while we have increased a lot of our investment in permanent supportive housing, especially because we needed it, we're also aware of the fact that we're not going to just be able to build our way out of this. We do have to do some turnover from our PSH projects that are currently in existence. So that's some work that we're going to be kind of spearheading over the next year and a half to do more of those assessments, to be like, hi, you've been in this program for 2-3 years. Do you still need these services? If so, great, awesome, perfect. If not, can we get you into affordable housing with a voucher so we can bring someone else from the street that needs these services in? So, trying to address our turnover rate while still making sure that it's within our expected parameters is something we're working towards.
This is so helpful. We appreciate it.
Of course.
And I'd love to come down and visit.
Please do. Please do.
Anybody else have a question? Yep, Councilmember Gregg, you're recognized.
So glad you're here. I'm from the home state of Texas. I think you said your ratio was 20 per every caseworker,
13.
for every 13. That's incredibly low and impressive.
Yeah.
I would say that has a lot to do with your success record right there.
Well, and this is one of the things where we see the difference in cost between rapid rehousing versus PSH, right? Rapid rehousing might have a higher case manager to client ratio, we're looking at 1 to 18, 1 to 20. And the 1 to 13 is part of that PSH build, right? You're going to need, because they're serving that higher acuity of individual, you're going to need a higher intensity of service. And also the populations aren't analogous, right? If you get a PSH person and you put them in a rapid, they're not going to have the same outcomes. They're not going to likely to be outcome positively. And so I think you need, your system needs all these interventions. It's, are you funding them to scale?
It sounds like you're tracking the data well as to prove these outcomes. So
Yes.
We try to.
bravo to you guys. I'm inspired.
Thank you.
Anybody else? To the Austin folks, can't thank you enough. Really, this has been a really, really productive couple of days. It was very interesting to dive into the funding mechanisms yesterday with y'all. I think there's a lot of good takeaways for the city with that. Dr. Alarcon, you highlighted that it takes a village, and it does, and it really requires to combat this when those villages talk to each other.
Exactly.
And I'm looking forward to continuing this relationship, taking a trip myself. Thanks to Director Calvin, her entire team for setting up these couple of days. It really means a lot. I think this is going to be good work going forward. One last thing to clarify, Dr. Alarcon, you referred to UT. We all know that the real UT is in Knoxville.
University of Texas
just
at
wanted
Austin.
Just wanted to clarify that before we get out. All right, we're adjourned. Thank y'all.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.